Hello and welcome back to The Halfway Point. In a recent episode, we spoke about neighbourhood working and what the future of the NHS neighbourhoods could look like. Well, today I'm really pleased to say we're bringing that to life, because this episode is all about a project where we can actually see neighbourhood working in action. So we're going to be talking about a really exciting piece of work in Nottingham City, focused on prevention, digital innovation and making health more accessible in the community. And I'm delighted to be joined by three guests who have all played a key role in making this happen. So let's start with some introductions. Michelle, Phillip and Jez, thank you all for joining me today. Can I ask each of you to briefly introduce yourself and your role in the project? Let's start with Michelle.
Yes, hello, I'm Michelle Freer. I'm Transformation Manager. I work with Nottingham City Place-Based Partnership and I'm employed by the Nottingham and Nottinghamshire ICB. And I'm really pleased to be here. So thank you very much to be talking about our SISU Health project and our CBD prevention programme.
Brilliant. And then Jez, over to you.
Hi Ben, yeah, thanks for having me. So I'm from SISU Health. I'm responsible for growing SISU in essence. SISU's provided the digital infrastructure to deliver the health checks in the community.
Brilliant. And then last but not least, Phillip, over to you.
Yeah, so I'm Phillip Stimson. I'm one of the senior innovation leads here at Health Innovation East Midlands, and we're responsible for bringing innovation to the NHS for our local systems and relevant members of the community.
Brilliant. Well, thank you all for joining me. A good place to start then. So let's look at the need in Nottingham then. So Michelle, what did you find? What was the need in Nottingham that kind of inspired this project and what it's kind of responding to?
So Nottingham have developed a programme focused on CBD prevention over the last 18 months. Having seen a high number of individuals attending ED with stroke or heart attacks. So what we wanted to do was work with our population and with organisations, whether they be health or non-health, across the city to focus and encourage them to go and get a blood pressure check so that we can really focus on that prevention and encourage people to really own their own health and lifestyle, and also know what their blood pressure is, as well as then prevent those going into hospital and actually having the healthcare at the time, at the need, at the point of knowing what their blood pressure check tells them. So as a programme, we've developed a cardiovascular prevention programme, which has lots of different projects focused on pre-prevention, prevention, secondary prevention and intervention. And so we've put together a Know Your Numbers campaign as part of that pre-prevention and education across the city. We supported the Know Your Numbers campaign that's led nationally by Blood Pressure UK, and we developed a pathway encouraging and signposting people to go and get their blood pressure checked in the community through their community pharmacist. We chose to elongate that particular campaign to an extra 2 days. So ordinarily it was the 7th to the 14th of September last year, but we extended it to the 16th because we know that we've got a high number of individuals that are working, that are choosing to take action at the weekend, but the community pharmacist was closing at 1 o'clock. So we really wanted to know, well, how can we help individuals that are working but go and get the blood pressure checked, which actually is in a place that's close to them, local to them, and meets their needs at a time that meets their needs. We also have different projects focused within that programme. For example, with Not Deaf Society, where we were finding that they were having problems with communicating with individuals or doctors, GPs and pharmacists, whether that be in primary care or secondary care, having to explain what the problem was or that they wanted a blood pressure check, because not everybody does actually work with and use sign language, British Sign Language. We also have worked as part of our health inequalities projects with the Black community, so majority Black-led churches, and also with a local Asian radio station called Farza Radio, to understand why Asian women specifically and Black men are not going to get the blood pressure checked. And what we found was that there were barriers around language, interpretation, and also as well trust for the NHS. So of course what we've then been able to do is explore different options available to us, and of course with the national mandate of digital innovation being such a big factor now, and people being able to go closer to home to get the blood pressure checked or focus on that prevention for themselves and take ownership, we really felt that we wanted to look at something that was available and in a space that was able to be utilised within the weekends, for example, all the time for our population to go and get the blood pressure checked. And this particular station was something that we wanted to explore.
Okay, that's a very broad area then that you're trying to cover. And I think that's brilliant because you're covering kind of that prevention and access and the health inequalities that can often go amiss with these kind of projects when we just focus on just the GP practice or just say the pharmacy. So it's great to see it expanded. And then, so kind of how does that link into the wider ambitions for the neighbourhood health and the population health management? I guess more so in your area in Nottingham, but kind of, I suppose, a bit also broader. How does that all fit in together, do you think?
Yeah, so we know that obviously GP practices have real capacity problems and really struggling to get people through the door. So have a station in a neighbourhood or in a place where people can go along without an appointment and have the blood pressure checked. It means as well that they'll be able to only attend a pharmacy or GP when there really is a need. And actually then that GP can provide the intervention. What we've found with the station is we've actually where can we put it, where can it be located? That was our biggest factor. It wasn't about having the station, and it wasn't about people using it, because we know that people would. It was just about where can we place it. And we've been really fortunate as a project team to build a really positive relationship with Boots Pharmacy. We know that Boots pharmacies are open at weekends because, of course, Saturday, Sunday for sales, and we've been able to place it in a location in their pharmacy at Boots Victoria Centre. And what we were really fortunate to find as well was that they've given us that space for free. But what I had previously were two stations that were just for height, weight, BMI that you put £1 into, but they'd actually been out of order for 18 months. So we've actually been able to radicalise that space as well with something that's available, obviously works all the time, doesn't break down. If it does, we've got, of course, SISU Health to support us with getting it fixed quite quickly because there's somebody at the end of the phone, and it's looked after. And of course, it looks really, really good, and it has been really, really dynamic. Obviously, I've talked a lot about those over the age of 40 and those barriers around interpretations. But what we've also been really fortunate about is the fact that the Boots Victoria Centre is very close to the Nottingham Trent University and those university student accommodation. We've been able to work with Thriving Nottingham, which is our integrated wellbeing service, and we've also been able to work with CGL, which is a drug alcohol support service. And they actually focus not only on those over the age of 40, but actually 16 plus. So we're in a position, a very unique position, where we've been able to obtain individuals of the population younger than the age of 40 to actually go and use a station, get education and support, as well as then be onward referred for weight management, smoking cessation, drug and alcohol support. And actually then really, really entice that prevention and education at an earlier age so that we can really prevent that high blood pressure at that older age and encourage people to have a healthier lifestyle for much longer.
Wow. Okay. Yeah. So you're covering all bases, which is brilliant to see, and it's great to see it across the city and across the neighbourhood. Philip, then, so going on to the health innovation side from East Midlands, then, kind of what were you looking for projects like this? I suppose what made this jump out at you?
Yeah, obviously a very exciting project, but just to give you, I guess, a little bit of insight into how Health Innovation East Midlands kind of supported the project. So SISU and our relationship with Jez has been there for quite a while now. They were one of our successful applicants to be part of our GROW programme, which is around supporting innovators who are at various stages of their development, try and secure, I guess, opportunities through the NHS in relation to their innovation. We're trying to align innovations to needs of our systems, and we do that through our GROW programme. And within the programme, we provide various different supportive opportunities for each of our innovators, one of which is, showcasing at events, aligning them with relevant members of staff that have expertise in the NHS and the knowledge of the NHS in knowing how to successfully implement innovation. Brokering relationships between the innovator and our local system providers, whether it be acute trust or community providers, general practice, mental health trusts, or whoever. So in relation to this particular project, what we did was to produce what we call an innovation exchange around cardiovascular disease. And what that does effectively is provides innovators with the opportunity to showcase their solutions against the needs of the systems that have been identified through what we call challenge statements. So our systems have basically said to us, these are our needs within the context of CVD. And then we go away and we produce an innovation exchange, which then is advertised to all of our systems. People come along and join as delegates. And this particular one was back in March 2025. And his team at SISU, were the successful applicants in being able to present at that innovation exchange. And then a spin-off from that was funding that we made available should systems want to actually put an application in for trialing the use of this innovation with a view to then rolling it out at scale, gathering the evidence, building that evidence. And, part of our role at Health Innovation East Midlands is taking that and spreading that across other systems, whether it be in the acute sector or primary care or wherever. So that's basically how we've got here today. The team at Nottingham produced a fantastic application, and they were successful in securing some funding from ourselves to be able to have the 2 stations, one of which Michelle's mentioned in Boots, for 12 months. And over that period of time, we'll be continuing to work with the team at SISU as part of the GROW programme, continuing to support them, but also gathering the evidence so that we can influence others to roll out the solution, should it be successful and meet the requirements of the patients ultimately. So that's kind of where Health Innovation East Midlands have supported and continue to do so. Again, building those relationships and being able to identify solutions that can meet the needs of our NHS partners, across the spectrum.
Following the success of LPM's very first New to Practice Manager Conference, we are bringing them back with dates right across the country. This year, we're heading to Hull, Salisbury, Newcastle and Preston. And the best part, it is completely free to attend. If you're new to the practice manager role and feeling like everyone else has the manual except you are not alone. These conferences are relaxed, practical and honest. Real conversations, useful learning and tools you can take straight back to your practice. You'll also meet trusted industry partners, leaders in their own field who are there to support you and help you grow with confidence. You will leave clearer, better connected and ready to lead. Head to locumpm.co.uk to book your free place and follow us on LinkedIn and Facebook to stay up to date. We would love to see you there. So the GROW project then is almost the backbone of getting these projects off the ground across the East Midlands. So again, it's really encouraging to hear a programme like that, and especially in the sense of, when you've got a good idea like this and you've gone through it, now you've got a lot of the hard work done, so it can be replicated across different areas now, and working with other companies nationally and locally. So that's absolutely brilliant to hear. I suppose then digging further into about it, if we look at the actual hardware and the software itself, the technology, I suppose, those who haven't seen one before, what is a SISU Health Station and how does it work?
Absolutely. I'll just explain the brand as well. So SISU is a Finnish word, which means to be resilient and keep going despite things getting really, really hard. And it was a word that sort of became part of the national psyche during the Second World War and during the Soviet invasion. And the reason why we like that as a brand is because preventative health is tricky. It's really hard. And as an individual, as a person, keeping on top of your health and making sure that you're keeping healthy, it only gets harder, right? And you've got to keep working. And I guess as a society and as a system, we need to do the best we can to support people in that journey. So in terms of what the platform is, we have what we would describe as a hardware-powered SaaS platform or a hardware-powered digital platform. So we have 2 pieces of hardware. We have a health kiosk, large version. People often see things in other environments, but in essence, with ours, you can sit down, there's a touch screen, and you can guide yourself through a health check. It's supposed to be self-service, and that's a really, really key point to make, because actually a lot of people don't like doing health checks with people. They don't like the judgment that comes from that. And that's why they like to do it in a self-service way. So they can sit down at a machine, whether that be in the boot store in Nottingham, in a library, in their workplace, and then they can take themselves through the health check. And we'll ask a number of different questions which feed into some of the risk-based algorithms to understand where they come from, a little bit about them. And then they can do blood pressure check, which also looks at heart rate as well. We do height and weight, which gives a BMI reading. And we also do body composition, and we focus in on body fat because there are some challenges with BMI, and body fat offers a nice juxtaposition. It's the usual story around your rugby players or your average gym goers. Everyone knows about that. And then there are a number of different algorithms in play. So we'll look at things like cardiovascular disease using Q-Risk, some other risk surveys. We'll look at mental health, alcohol dependency. So a lot of the surveys which form part of the NHS Health Check. And in its total, actually, we can deliver all of the components of the NHS Health Check, aside from one thing, which is the pathology. And one of the things that we often talk to people about is actually we can offer an opportunity to triage, and we can triage opportunistically in the community or directed as well.
That's a really good example of of how it works within the community, I suppose, outside of the GP practices. So we talked about the health check being done almost individually then, if you like. How does the individual get the support, and equally the wider health system? How do we get that data flowing back to the patients so they can look after themselves, but also back to the GP practices or wherever else it needs to go?
Yeah, it's a good question, Ben. So for the person that's actually done the health check themselves, they can access. So they see all the results and recommendations about what they should do on screen, and there is. What we often do in different settings, or perhaps I'll let Michelle explain in terms of what we do in Nottingham specifically in a moment, but we often create signposting and pathways. And that can be quite light touch. It could be quite simply, you've indicated you're a smoker. Are you aware there's a smoking cessation service at the pharmacy a few hundred yards down the road? And we do this in different locations. Right up to giving people an opportunity to self-refer in to a specific pathway. And again, I'll ask Michelle to have a look at the moment. What they can also do beyond that health check is they can access the results via the SISU Health app and web portal, and they can access that within seconds of completing the health check, and you can have a look at that. And what we do see is a lot of people are monitoring their blood pressure or their weight, and they'll often take their readings into GP practice. And it's a Class 2A medical device, so it's very accurate.
Brilliant. Yeah, please, Michelle, if you could expand on where Jez is saying about what happens next, really, with the data side of it.
Yes, so what we've had is when the individual is at the station and they will have their height, weight, BMI, and they'll have the blood pressure check, they'll then be asked a series of health questions, and it's related to their health lifestyle. So the ones that we've chosen is the alcohol questions, so the Audit C, and also the PAR-Q, which is around the exercise. It'll also ask them general questions as well, included in that around obviously their smoking status as well. And then they have a set of options. So where I mentioned earlier that we're working with CGL and Thriving Nottingham, the individual can actually then say if they wish to receive a phone call from Thriving Nottingham to be triaged if they wish to participate in additional services that they offer. So CGL offer the alcohol and drug support services, and Thriving Nottingham offer smoking cessation, weight management, and increasing physical activity sessions all across the Nottingham City, which is actually being funded by our public health team. So those referrals will go directly just with consent of that individual saying yes, they're happy to accept a phone call, and then the information will go then to Thriving Nottingham as an email inbox that they've got, and they will then pick that up and they will then give the individual a call, ask them again if they're still happy to be a participant of Thriving Nottingham, and then they'll go into that service and be referred for lifestyle support.
Wow, okay. I suppose we talked about lots of different other organisations involved with it. If you're, I'm just thinking about other areas, how did you get the partnership working across Nottingham City? How did you get that off the ground with all the different organisations to come together for a project like this? Because it can be overwhelming sometimes and feel very, I suppose, isolated for the person trying to organise it, dare I say, which probably fell on your lap, I think, Michelle, for this project.
So the project, as I said, is part of a programme, and the programme is led by our Assistant Director, Kira Stewart, and Dr. Andy Foster, Clinical Director of the Nottingham City Place-Based Partnership. And as part of that partnership, we have all different organisations that they have, non-health and charities across the city that come together with that focus of prevention of cardiovascular disease. And the reason that we discussed with them all around cardiovascular disease being our main factor or our main prevention strategy was because of the number of those individuals going into ED with heart attack and stroke. So we really were able to pool resources. When we then led our Know Your Numbers campaign, it was real hard work, but we really got not only those individuals from our programme involved, but we had over 100 organisations, health and non-health, that got involved in that particular campaign. I was walking all the way around Nottingham, giving them posters, key rings, all different things. We had posters on the buses, we had QR codes, and we had our ICB media and comms manager Rob Shirley involved in creating lots of different videos for us that went onto social media. And from that campaign, just a simple social media video with GPs and pharmacists advising people to get the blood pressure check, we were able to get nearly 15,000 views, which is really unusual for just a simple health video, go and get your blood pressure check. But we were really fortunate to get that much traction. And it kind of really just stemmed from there, that we had so many charities wanting to be involved, opticians wanting to be involved, as I say, Boots as well. And then that's what's led to those really positive relationships. We've got a Healthy Hearts newsletter related to the programme, so we share that across the city, giving updates as well as advertising the different heart health related services that are available, and helping people to improve the lifestyle, which is shared with all different professionals as well. So yeah, we've really worked hard as a partnership to develop this programme, and as I say, it's down to that leadership of Dr. Andy Foster and Kira Stewart.
Brilliant. And I guess we talk about a lot of positives, but and I kind of open this question to the three of you, but what are the challenges? I suppose it would be unfair if I didn't ask the question, what are the challenges getting it from idea to implementation? And I suppose kind of following on from that, what's the kind of key learning points you've come across to overcome it?
I guess if I can come in at this juncture, from an innovation perspective, I think what's crucial is understanding your target audience, and the target audience being the patients, citizens, within the neighbourhood health environments. A lot of our work, we've got dedicated staff that look at that, patient involvement, engagement. We've got the clinical senate. We've got various different arms to the kind of patient informed agenda to then drive, those conversations with innovators through our various different programs within the Health Innovation East Midlands, and also the Health Innovation Network across the country, of which we're one of 15 health innovation networks, Ben. And so, really at the heart of everything that we're doing is that kind of patient-informed agenda, and then really being part of conversations with innovators and through our various different exchanges to really make sure that the innovations are grounded in that patient, that, first and foremost, and notwithstanding, obviously, addressing the wider needs from a public health perspective and the system needs in terms of the financial challenges and the demand and capacity and what have you. But really at the heart of it is genuinely the patients, and then through our relationships with innovators, SISU being one of them, and we can make sure that the solutions that we're suggesting are fit for purpose and meet the needs of themselves as individuals, and then their systems in terms of their wider challenges and demand and capacity agendas. Jez, I don't know if you want to come in, just kind of building on that, maybe.
Yeah, it's probably a challenge, perhaps a little bit less related to this project, but a challenge that we as an innovation in that prevention space faces is, and there's going to be no surprises here, is all around the sort of integration with patient records and the incremental approach that we as an organisation have to take. And we've worked on a number of other projects. We did a big project with Solihull Council to do the full NHS health check with Jaguar Land Rover, which was a project commissioned by DHSC. That moved us along in quite a big way, and that we were able to sort of move data directly to GPs from those health checks. And we're having to incrementally, every time we go into a new project, because each system has a slightly different approach or a different set of objectives or a different set of challenges, it's that incremental change. So that digital integration piece, the patient record integration piece, continues to be a challenge, and we continue to make progress.
I hear you with that one. Michelle, anything to add from your end then on the challenges and learning side?
Yeah, I think from our perspective, as a healthcare professional, trying to actually have something available for so many different people in our population, because obviously our population is so versatile. It's looking at digital innovation, looking at what's there, but actually what's going to fit and how is it going to fit. And that's the real benefit of this station is that's quite key. Everybody's looking for a digital solution. We are. we can have 20 million different, and we all do, don't we, have 20 million different programs on our laptop and about a million different passwords, and we can't remember them every day. The difference with this station is the fact that it's available, but it can be used in just so many different ways. If you look at the patient pathway, we've got it for prevention, but actually how else can it be used? Well, it can be your pre-op. It's there as your pre-op. It does everything for you. It can ask you pre-op questions. You can place it in a hospital. You don't just have to have it for prevention. So I think having something like this, which is for 16 plus, you're already in that space of your pre-prevention, your prevention, your education. It's also something that people can keep going back to. You don't need to have an appointment. And in addition to that, you can also have it utilised for different parts of secondary care as well. And I think where we are now as professionals, looking at that neighbourhood health, looking at that digital innovation, it's not just digital innovation, it's actual integration as well. How can we integrate it into our lifestyle? We're all looking at health hubs, but have we actually considered that pre-op in a health hub closer to home? You don't need to go to hospital to have your pre-op. How many times are we waiting on a waiting list at the moment for an operation? And then how many times do you have to keep having a pre-op? Do you really have to keep going back to a hospital for that? You've got it. That station's there. A real, what we call now a real health hub. It's there. It does everything. And that's what's really positive about this station, is the fact that we've got it for our 16 plus. We're using it for our uni students. We're using it for our population that are deaf. We're using it for our population that are struggling with those language barriers. We've got it for the older people. We're now started to look around, working with Age UK Nottingham, around how can we educate our older people to embrace digital and become more digitally inclusive, as well as then having it there for that pre-op opportunity as well. So I think, this is a really positive investment for us, and I'm really thrilled that we've got it, and certainly with Boots to be able to work in partnership with them, as well as our integrated wellbeing service, our drug and alcohol support services that are all included in that, in just surrounded in just one piece of equipment. One piece of equipment can do just so much.
Yeah.
And it's surprising. It's so surprising. But, that again, we're all looking at how can we save money? How can we optimize our resources in the best possible way? And this station does that all in one place. And what I want to just finalize on is that, Jez sent me just before we met today, how many blood pressure checks and how many health checks the station's actually carried out. So we had it in place. We did a soft launch in the fact that we had it just quietly put in Boots on the 9th of December. But we did our official launch in January. We wanted to really focus on that sort of new you, new life, new start, that sort of thing in January. Since 9th of December to today, the station has carried out 3,885 health checks for 16 plus. And, it's focusing those individuals that are coming in from our populations of IMD 1, 2, 3, so they're really low in deprived areas. It's been utilised. And in addition to that, it's also triggered 908 health checks to go to see their pharmacist with high blood pressure. So it's really making a huge difference to our population, which is really, really impressive in such a short space of time.
That's an amazing outcome. That's in the couple of months, finding those potential future CVD or stroke or whatever it may be cases and preventing them. That's, even if you find one of them, that's a win, but nearly 1,000 is huge. And so, yeah, congratulations to you and the team. And so I suppose the continuation then is, as you said, I guess trying to roll it out further, put it into more places, increase those numbers even more, and expanding that further. And I think you highlighted where some of the other use cases can be. I'm just thinking of other things. There's when you're going to the hospital, you're taking up a parking spot. Well, you don't need to go to the hospital. You don't need to pay for the parking. There's such a knock-on effect of something like this, where if you think slightly differently outside of the box, the outcomes can be huge. So that's a lovely note to end. Well, thank you all three of you for joining us today. It's been really insightful. I've come away with a lot, and it's a fantastic example of kind of how the neighbourhood health is expanding, of what we can do when we all work together. And initially looking at like prevention, but also the digital innovation and working with different sectors to kind of meet the needs of our patients and improve the patient health. So if you'd like to learn more about this project, or even set it up in your own area. I'll leave all the details and the links that we talked about today in the episode show notes. Otherwise, thank you all for joining me today. Thanks everyone for listening, and we'll see you next week at the halfway point. Thank you.
Thanks, Ben.
Thank you for joining us today for another episode of The Halfway Point. We hope today's conversations has given you a fresh inspiration and practical ideas you can take straight back into your practice. You'll find all the links and resources we mentioned in the show notes at locampm.co.uk. The Halfway Point is available on all major podcast platforms in both audio and video formats, so you can tune in however suits you best. If this episode helped you, we would genuinely love to hear from you. Leave us a review or a comment. Not only does it make our day, it also helps us shape future episodes around what matters most to you. Make sure you follow and subscribe so you do not miss next Wednesday's episode. And if you know a colleague who would benefit from this conversation, please share this episode with them. You can also connect with us on LinkedIn and Facebook by searching for the Locum Practice Manager. We're on YouTube too, where we share practical tips and tutorials for primary care managers. Until next time, keep moving forward, keep improving, and we'll see you again next week at the Halfway Point.